cash flow to planning for MSRA.
Perfect. All right, next. And Nina Ona, do you want to introduce and what specialty you are writing this exam for?
Yeah, my name is Nenana. I recently passed last year, but I'm still searching for a job. Yeah, I'm looking forward to writing the MRSA for psych.
For psych.
Yeah.
All right. And thank you. And Oluwato Funmi. Can you hear me? Okay. And Ru.
Hello, I'm Rohanti. I'm from Sri Lanka and I'm awaiting my FLAP 2 results. And meanwhile, I've been
Okay.
preparing for MSRA in GP part.
Okay. And then C Bologan, I think that's our host, if I'm not wrong.
That's correct.
Yeah. Okay. And then Toba Aladdin Rin. Okay. All right. So that's fine. We have 18 participants. I actually remember I was getting a lot of messages. So is it okay if I just take a minute and see if someone else is struggling to join in?
Yeah.
Yeah.
I'm also doing that at this end as well. So
Okay.
Thank you.
So
sorry, gents. It's just that people have some people have said they
yeah.
have issues logging in. That's why we're just making sure that we try to help as many people as
I
possible.
think
So thank you.
that's fine. We can just start
Awesome. Thank you.
the session. All right. So next session. So what is the MSRA exam? So this is it's a multi-specialty recruitment assessment exam. It's like a computer-based assessment used for entry into various specialties like postgraduates, medical specialty training programs in the UK. It objectively evaluates your competency in key areas just to make sure that you are safe to start your training here in the UK. And it also helps you to shortlist for the interview process. So there are only two specialties, GP and psychiatry, where MSRA is the only assessment tool for you to get into the training. But for other specialties, it works as a shortlisting criteria. So you have to go through above a certain limit to get shortlisted. And then you get shortlisted. After that, you have interviews, and then you are allowed to, upload your portfolio. And in the end, the MSRA also might contribute as some percentage of the total, collective marks to get into that training. So GP and psychiatry used to have interview process and the portfolio as well, but they scrapped it off in the COVID. And because it was in the shortage occupation list, they have not reintroduced the interview process yet, but we never know, it may change in future. So the results are used differently within each specialty. So it's useful to check specific national recruitment websites for further guidance on individual specialties. So the weight given to the MSRA score can differ between different specialties. All right. So this is actually, for example, if people, I can tell you about Pakistan. In Pakistan, we have this FCPS Part 1 exam for you to get into a specialty, and that exam is different for each specialty. But here in the UK, there's only one exam, and the same exam is used for every specialty, but it's only one part of the process, so it's not the whole thing. I hope that's clear. And then who needs to take this exam? Junior doctors applying for specialty training positions, usually after foundation years. Once you have done your F1 and F2, you are eligible to apply for it. Overseas IMGs can also apply for specialty training. And it's not a pass and fail exam. And the scores are very important if you want a specialty of your choice or you want to, train in a particular location. So that's important. So scoring high is very important and crucial for this exam. All right. And now let's talk about what specialties it covers. So ACCS, which is emergency medicine, anesthesia, CT1, and then broad-based training as well. So it's not very common. Anybody knows about the broad-based training? Anyone has any idea about it? Because this is something not often talked about and may also be helpful for people who are, applying for jobs or training. So it's a 2 years training program only offered in Scotland, and you are rotated in 4 specialties, that is internal medicine, psychiatry, GP, and pediatrics. And after you complete those 2 years, you are allowed to enter any of these 4 specialties, and you start directly from the second year of training. So 1 year is omitted in whatever specialty you choose out of these 4. So this is only for Scotland. I think it's a very good starting point if any of IMGs, I know a lot of people these days, some are trying to directly enter into training, although it's not recommended. But I would say if you have to do something, look at broad-based training, because it's well supported and it's not like a direct entrance to your training. So that's something to make a note of, I would say. So application windows open in November, and usually the training starts in August. So, and after that, radiology, we know, community sexual and reproductive health, core psychiatry training, core surgical training. Surgery was not part of MSRA before, but now they have included this in the selection process. And then GP, we all know, and neurosurgery as well, ST1, ST2, and ST3 levels, nuclear medicine at ST3 level, obs and gynae, and ophthalmology. So all these specialties use MSRA exam for you to get shortlisted. Okay, so I think there are only 2 specialties which do not use the MSRA score. That is, one is IMT, which is internal medicine training, that is only based on your portfolio, and the other one is pediatrics. So pediatrics did use MSRA in the past, but they have now excluded it from the selection process. So these are the specialties that uses the MSRA score. And then what is the eligibility to apply for the exam? So UK medical graduates, usually after completion of foundation program, you must have completed your foundation training program, which usually lasts for 2 years. And for overseas IMGs, you should have a full registration with General Medical Council to be eligible to start your training. And this requires passing both your PLAB 1 and PLAB 2 and getting your registration. And you also need 2 years of postgraduate experience, including your internship. So this 2 years, you should have 2 years of experience before you start training, not at the point of application, or not at the point where you submit your application to enter the specialty. So it's important to make sure that you have that adequate experience before the start date. And CREST forms should be completed. So here in the UK, you have the when the doctors enter into the foundation training, everything is automatic, everything is streamlined. There's no problem with that. But for IMGs, we have if we have not done like a routine foundation training as UK graduates, then we have to have the CREST form signed, and there is a deadline to that, and that is usually in the ORIAL application. So when you apply for your training on ORIAL, they will give you a date that by that date you should submit your CREST form. So that is important to know. And sometimes people ask who can sign it. Any consultant can sign it. Okay. And then location and cost. So the MSRA, we have discussed, there's a computer-based exam, so you don't have to travel to a specific test center. You can take the exam at any Pearson VUE test center around the world. It's like a global network of professional testing centers. You can find your nearest Pearson VUE test center by visiting their website. You can just Google it, or you can just take a screenshot of this slide. So you can just copy paste the link. You'll find what are the test centers near you. Availability at your preferred test center can be limited during the MSRA assessment window, so booking early is crucial. So if you want to have a particular test center location, then so if you have a particular location, then you have to book as soon as possible so you can attend that session, that center, okay? And you will need to register for an account with Pearson VUE. So once you are longlisted, you will be sent an invitation where you can book for that, where you can register for an account on Pearson VUE. So when you apply for your application, usually you get longlisted. So long listing is based on if you are eligible or not. So they look for things like you have 2 years of experience by the start of training, and you have your GMC and things like that. And once you are longlisted, then they'll send you an invitation link that you can then make an account on Pearson VUE, and then you can book your MSRA exam. Is that clear so far? Anyone has any questions so far? Just want to make sure that I'm not going too fast. Okay. And then if you reside or are employed in the UK during the assessment window, then you are expected to attend a UK test center. So for those people who are already working in the NHS, you might be working as a trust grade or a junior clinical fellow, then you are expected to sit this exam in the UK. If you are outside the UK during the window, you can take the exam at a test center nearest to your location. And the exam itself is free for applicants. However, there might be associated costs depending on your situation. There are some test centers they might charge a fee for using their facilities to take the exam, and the cost can vary depending on the location. You can usually find this information on the Pearson VUE website when searching for test centers. And the travel costs are usually not refunded. So if you are doing this exam far away, so it's all on you. So that's about the location and cost of this exam. And then now we'll move towards the structure of exam. Can anybody just confirm that I'm audible? Any problems with my audio or any problems with the slide? Can anyone just confirm everything is okay? So we move forward?
Yeah, everything is okay. Let's move forward.
Okay, perfect. Thank you. So so that's a little bit of idea about what this exam actually is. And now we'll move towards the structure of the exam. Okay. So so this is a 170 minutes. You have total of 170 minutes. So roughly you get 1.8 to 1.9 minutes per question. There are two components, professional dilemma paper, which is also called situational judgment test, SJT, which assesses your non-clinical skills like your communication, your professionalism, and ethical decision making. You will be presented with a scenario and asked to choose the most appropriate response from a list of options. I really want to highlight this part because this is more crucial, and this would be the main focus of our talk today. Because clinical questions we are aware of it, because that's something we are used to. We have done this in our medical school. You have done this exam for your PLAB 1, okay? But the SJT part is something we are not usually used to, and this would be usually based on your practice and how the practice works in the UK. So you would be at you will have an edge if you're already working in the NHS compared to someone who has not worked in the NHS. And it's all based on situational assessment. So it's usually not assessing your clinical skills. And then you have clinical problem solving questions. So it's usually the normal questions that we are used to. It assesses your clinical knowledge and problem solving skills and how you apply your clinical knowledge to a particular case. Now, what happens if someone has the same score? For example, two doctors, they have the same MSRA score, but someone has to be ranked first. So they see who has the higher marks in the SJT part. So the person who would be having higher marks in the SJT will get the preference. So this part is really important. And this is something we'll discuss more later on, okay? So usually you get like a 10 minutes break in between and then you move to the next section. So you might do clinical part first and then you'll have a small break and then you'll have the SJT part. I don't know this. It has disappeared, the slide. Can anybody see? Because I can't. Can everybody see the slides?
No.
Slides?
No, we
So you
cannot see it.
need to share again
Okay, let me try
or
again.
whatever the reason. Don't worry, some things happen. Yeah, it's
That's
coming
fine.
now.
Yeah. Okay. So yeah, we were talking about the structure of exam. So you have the SJT part and the clinical problem solving part. And I want to emphasize again that SJT part is very important. Practice it as much as you can. Okay. And again, you might get you'll get around 50 scenarios for your SJT or professional dilemmas. You'll have 95 minutes for that. And your clinical problem solving, you'll have 86 questions and you'll have 75 minutes to solve that. And now we'll dig a bit more into the SJT or the professional dilemma. So what we'll do, there are three main domains where you're tested, and we'll go a little bit deeper into it, and we'll do some examples so that you can understand it well. So there are two types of questions within the SJT part. One is the ranking. So you'll get a number of options, maybe 4 or 5 options, and you have to rank it. So on a computer, how it appears, you kind of drag and put it, put it in order. That what would be the most likely scenario, what would be the most appropriate action, that would be you place it first, and then you arrange it order wise. And there would be multiple choice. You'll be given some plausible actions for each scenario and would be asked to select 3 most appropriate or 2 most appropriate actions. So that's the pattern of the SAT. And like we've discussed, it contains 50 questions, 95 minutes for each. Only 42 items account towards the final score. So usually there are pilot questions in both clinical problem solving and the professional dilemma part. So there would be around 7 to 8 questions which they are just testing for future exams, and they might not account towards your real score, but you won't know what are those questions. So again, this portion actually it measures your understanding of situation that arise for doctors in NHS during a foundation placement and judgment in choosing more or less appropriate responses to that situation based on an understanding of what is more or less important. So everything they are testing at a foundation year level. So this exam is actually basic. It's not very difficult, to be honest. It usually just tests your basics because they know that they are going to train you. They just know that you have the basics covered and you know how to deal with common situations that may arise for you working as a junior doctor. And And then we have this professional dilemma. Then we have this three core domains. So there are three core domains that usually that you're tested on. Number one is professional integrity. Number two is coping with pressure. Number three is empathy and sensitivity. So these are the hallmarks, and that's what we are going to discuss in detail now. Okay. So professional integrity. So it's actually, this domain focuses on your honesty, your ethical conduct, and commitment to upholding the professional standards. So your good medical practice comes into play here. You can, read through it. It's available on the internet. You can read the good medical practice in your spare time. Um, but that's what they actually test you on. And imagine scenarios where you might face a difficult decision. The SJT will assess how you prioritize patient well-being, act with integrity, even when it's challenging, and avoid conflicts of interest. So let's take an example. And I want it to be interactive, and I want you guys to respond to me. Just open your mic and discuss it. It will help you to, gather some idea and prepare for it better. So a colleague asks you to cover for them while they attend a personal appointment during their shift. Okay. So suppose you're working as an FY2 in general medicine, suppose. And then a colleague comes to you, say that he has a personal appointment, maybe he has a dentist appointment. They have done this before, and it puts extra strain on the team. What would you do? Anybody would like to tell what they would do in this situation?
Okay.
Yeah, someone's mic is, yeah.
All right. For I think first of all, I would like to have a word with the colleague first of all, and ask if he could reschedule or book for the their personal appointment on another day. So I will explain that this has been occurring before, and it doesn't look good, and it's putting so much strain on other team members. And if he doesn't agree, or if he continues to do the same thing, I'll have to escalate it to the seniors.
Yeah, perfect. Thank you. You're actually very right. Yeah, that's how we would do. So we acknowledge the situation, we explain and offer a solution. So yeah, of course, we can ask him to reschedule if he could. Or the other thing we can think about, if it's something very important, we can, rather than you taking the whole burden of his job, we can, ask or offer him to discuss this with the whole team and see if we can distribute the job among the whole team rather than you covering him. And also it's important to weigh up if you have to make sure that the patient safety is not compromised. So if without having the patient safety compromised, you can divide the job among the whole team, you can offer that solution. But yeah, the first thing would be to offer to reschedule. So yeah, well done. Thank you. So, so that's one example of professional integrity. Another example could be a conflict in opinion. So you and a senior colleague, so you're having a ward round, and you and a senior colleague disagree on the best course of treatment for a patient. What would you do if you have a disagreement? So you're working as an F2, and your registrar makes a plan for a patient, but you feel that it's not the right treatment plan. How would you deal with that situation? Anybody wants to give their input for this particular case?
Just to let us know,
Anyone?
if we can't answer verbally, we can answer via the chat box. You can either answer verbally or chat box. Thank you.
Okay, let me see if I can read the chat. Yeah. Oh yeah, I can see the chat now. So yeah, so when you have like a conflicting So what would you normally it has to be a respectful disagreement. So you express your concerns respectfully, highlighting the relevant clinical guidelines or evidence. It should be a patient-centered focus. So you emphasize the importance of discussing all options with the patient and involving them in the decision-making process. So in any case you come in your exam, if you just keep one thing in mind, that you always involve the patient in the decision making process. It's very crucial. It is something that would be tested again and again, that you do not just decide yourself as a doctor. You give options to the patient, you inform them, you let them know all the all the options available, and help them to actually decide for them. Does that make sense? And then openness discussion, be open to hearing their rationale and collaborating to find the best solution for the patient. So yeah, that's another example. Sorry. And another case might come as gifts and incentives. For example, a pharmaceutical company offers you a free luxury trip or an expensive gift. It doesn't happen much, to be honest, but an expensive gift that might happen. That they might offer you an expensive gift on in exchange for prescribing their medications more frequently. We have these pharmaceutical companies coming a lot in our GP practices. So this can happen. So how would you approach to this situation? Anybody?
Okay. Let me try. So I think that for me, I would have to politely decline. So
Yeah.
it's going to if the because you need to find out the rational sole purpose of you getting the gifts. What's the rationale behind the gift? Is it to prescribe more of
Mm,
the medication to the patient? So I think for
mm,
the major thing for gift is just to determine the mindset behind the gift. So if the pharmaceutical company wants you to prescribe medications and because of that offer you a gift, I think you should just politely decline the gift.
yeah.
Mm.
Yeah, that's right. So thank you, Tina. So that's what we would do. Yeah, decline politely but firmly. Explain that accepting such gifts can be misconstructed as a conflict of interest and can influence prescribing decisions. And then transparency is also important. You inform the relevant authorities if pressured or uncomfortable with the offer. Okay. And so yeah, so that's how would you approach to a situation, and that also explains how you maintain your professional integrity while you're working as a doctor. So that we have covered the first domain of SJT. I hope that is a little bit clear. And there would be, just basing on the same principle, they'll create scenarios. They'll just create different scenarios, and they'll ask you, how would you approach? And they'll give options accordingly, and then you have to mark them. And then and the second domain is the coping with pressure. Okay, so that, for example, you might have a scenario where you're overwhelmed by workload. So suppose you are an FY2 working in general medicine and you are the only on-call doctor during a busy night shift with several emergency cases arriving simultaneously. And how, as a doctor, you would approach to this situation? Anybody wants to give any input? So yeah, so what we would do, sorry. So usually, what you would be expected to demonstrate is that how you prioritize your tasks effectively. So ideally, what you would do, you would quickly assess the urgency of each case and delegate tasks to nurses and other colleagues if appropriate. And you would need to have a calm communication, and you clearly communicate with the patients and explain them about the situation that they are informed of the situation and they might have to wait more to be seen. So that's something they would be looking for, and maintaining focus. If you are, staying focused on the task which you have, and avoiding distractions. So there are two things: prioritizing and delegating tasks. This is something they would test you on. So how you prioritize your tasks. So of course there is an emergency, you would deal with that first. You actually see what can, if you are on a night shift, what can be waited till the morning, and what have to be dealt right now, and what are the tasks could that can be delegated. For example, if there is a cannulation in the ward and it's not like an urgent blood, you can, delegate one of your nurse colleagues and say if they can do the cannulation, and you can focus more on the things which are urgent.
Sorry,
So
just to
for
add, someone has dropped an answer, or I think is an answer to what you said, and it says triage, just from Fawaz
yeah,
Kazmi. So you might want to comment on that, please. Thank you.
yeah, Farwa, yeah, right, exactly. So that's triaging, right? So prioritizing, actually, that's triaging. What is important, you deal with that first. What is not important, you can leave it to the morning team. Okay. So those are the things you would be tested on. So yeah, that's again demonstrates how you cope with pressure in any clinical scenario. Okay. Another example, upset patient. So you are treating a patient who becomes frustrated and verbally abusive due to long wait time in the emergency department. So suppose you are an SHO working in A&E, and there's a patient who is waiting for 12 hours to be seen. And he just comes shouting at that, what is going on? I'm waiting for this years, and becomes verbally abusive with you. How would you deal with that situation? And suppose you are the only doctor at that time and everybody else is busy. Um, how would you approach the situation? Anybody wants to give any input? So suppose you've started working as a trainee doctor, and this is what you experience in your very first shift. How would you approach the situation? Anyone? Anybody wants to give it a go?
Well,
Okay.
okay.
Oh, I'm so sorry.
Yeah, sure. Please go on. Who was about to say something?
Please, Tina, go ahead. You're free to.
I was
All
about to
right.
say something, but uh, Tina, you can go ahead.
Yeah, Farwa. Okay, that's fine. Tina has participated before. I will give you a chance. So, yeah,
Yeah, so I was
you can
saying
tell.
that first, I think we need to be very calm about it, and we need to just
Hmm.
listen to that patient or the attendant, whoever they are, even if they're shouting at us. We need to show that we're there to listen to them. And
Hmm.
after we've suffered all of that, we can then actually make them feel like their patient is important, show some empathy and some regard, so that they know that we're not neglecting that patient. We're just focusing more on the other one at the moment. And then we can, in a very nice way, explain it to them how the other patient is very critical and they need more attention at that time, and we're short of staff or whatever the issue is. So probably when we speak to them in a nice tone, show some empathy, and when the doctor specifically, talks to the attendant or client, they will probably try to understand that, and it will buy us some time before they shout again.
Yeah, well done. Yeah, thank you.
Can I say
So, yeah, exactly. Yeah, sorry. Yeah, Tina, you want to say something?
So I was thinking from what Fawa said. I was thinking because I think for this kind of situation we shouldn't make excuses for ourselves. So I think what we should do basically is when we see a patient like this, like she said, we should calmly listen to the patient, understand their perspective. We should acknowledge and we should acknowledge their frustration. We should acknowledge their anger, then also try as much as possible to apologize and be very empathetic when we apologize to them. So I think telling them about another patient being busy and being short staffed, I think it shouldn't be part of what we should tell a patient. You know?
Yeah. Yeah, I agree. Thank you both. So yeah, so what you do, you de-escalate the situation first, you remain calm, listen patiently to the patient's concerns, then acknowledge their frustration. This is very important. The moment you acknowledge anyone's frustration, it will save you a lot in NHS. So this is something you always remember. Whenever you get an angry patient, first thing you do, just acknowledge, just say that, okay, Mr. XYZ, I do understand why you're frustrated. You know, anyone at your position would be frustrated with this waiting timelines. And then you empathetically explain the situation and explains the reason behind the wait time. For example, you could be short-staffed and you know the workload is more or whatever. And then you have to show a little bit of problem solving, how you can, you know, work collaboratively with the patient to find a solution, such as offering a pain medication or providing updates on their wait time. So you can, you know, come to a negotiation that, okay, if you are waiting this, if you are in pain, we can give you some pain medications while you are waiting, and maybe every 2 hour or every 1 hour we'll just update you about the situation and about the waiting timelines and how long the patient can expect to wait more. So that will, you know, give a patient a little bit reassurance that, okay, they are aware of my frustration and they have done something. And they would also acknowledge that it's not everything is in your hands, and it would calm down the situation. All right, so that's how you cope with pressure. So a lot of scenarios would be created like this, okay, which will test you how you cope with the pressure. And is that clear so far? We have discussed professional integrity and we have discussed coping with pressure. So two important domains we have covered. We'll go towards the third domain. But anybody has any questions so far? Is everything clear? Okay. All right. So let's move towards the empathy and sensitivity. Okay. So it's again, it just they'll just bring scenarios which would just test how empathetic you are and how sensitive and aware you are of the situation. For example, you might be presented with an anxious patient. You are treating a patient who is anxious and tearful before going a major surgery, and how would you deal with that situation? So, for example, you know, you'll get these things. You'll get overly anxious patients, which might not be, you know, which might not be a big thing for you as a doctor, because we are used to seeing these things, but that might be a very big deal for the patient, and the patient might be tearful and, you know, so anxious. So how would you deal with an anxious patient? Anybody wants to give any input? If anybody wants to give any input, that's would be great, or we'll just move forward explaining it. Okay, so yeah, of course, how we approach such scenarios, that number one, you have to have the trait of active listening. So listen actively to the patient's concern. Do not shrug it off. Just do not say that, oh, you'll be fine, but just listen to them. Just understand why they are so much concerned about that situation, and allow them to express their fears. And then number two, you need to have empathetic communication, acknowledge their emotions and validate their feelings, that, you know, I understand you're feeling anxious, you know, surgery can be a big deal, I know you are fearful, you know, uh, and so on. And then you provide reassurance and support. You explain that, you know, that there is support available, you know, we will do our best. We are, you know, for example, we are giving you, we will do the procedure under sterile conditions. We'll make sure that the chance of infection is minimum. We might provide you with some, you know, prophylactic, we might give you some prophylactic antibiotics. and we'll do everything to avoid any risks associated. So depending upon the patient's concern and query, you provide a solution for that. Okay. So that's how you deal with it. And another scenario, another example could be you're treating a patient from a different cultural background who has beliefs and practices you may not be familiar with. So, of course, NHS, this country is very multicultural. You'll see patients from all over the world, people from different cultures, different religious beliefs, and you are bound to come across such situations where there would be a thing that you would be completely unaware of and something that would be very alien to you, but it would be a big deal for the patient. So, how would you deal with such situations?
Oh,
Anybody?
okay.
Yeah,
Okay.
yeah,
So, um, well, I think for this one, I think that first of all, um, active listening to the patient is very important. Then also, I
yeah.
think one needs to be very patient centered. So, what you ask the patient, how would you like to be treated? What would you want?
Mm,
So it should be patient centered. So you need to like ask the patient questions. You should not just treat the patient based on your own knowledge or what you think might be best for the patient. So the patient should be involved in his or her treatment. So, like the by and large of what I'm saying is that the management should be patient centered. So from there, you are able to get to know the patient's culture, what the patient would like
mm.
as part of the treatment plan, how the patient will want to be treated, and all those things. Yeah.
Yeah, thank you, Tina. Exactly. So, yeah. So, number one, I think it should be a respectful communication. You communicate with respect and avoid making any assumption. That's very important. Ask open-ended questions to understand their cultural background and preferences. Just try to understand um, what they want to say and why it's a big deal, and then accommodate their cultural practices as much as possible, such as allowing them to have a religious symbol if they want, or have a family member present. I can tell you, when I was working in obs and gynae as part of my VTS, as part of my training, I was working in the postnatal ward, and there was a lady who wanted a female doctor to see her or examine her, and there was no female doctor around. So what I had to do, I had to go and discuss, and so what I do, I listened. I listened to the patient. So why, and I understood why they want to have a female examiner. And then I spoke to my team if there's any female doctor available to examine the patient. So that's at that point, I validated their concern and I went to do something for it. I tried to accommodate their request. Okay. And then on finding, I found that there was no female doctor available, and then I came back to the patient. I explained the situation that I do understand that you want a female examiner to be present, but unfortunately at the moment all the doctors are busy. There's only one female doctor at the moment, but she's busy in theaters. So, what would you like to do in this situation? Do you still want me to examine, or do you want me to just not examine? And then the patient agreed and she understood, okay, if that's the situation, I'm happy for you to examine. So that's how, so it's just an example. So you might get questions, with the same principle where they'll just test how do you understand cultural differences, how sympathetic or how problem solving you are in such situations. Does that make sense? Yeah,
Yes.
perfect. So yeah, so that's done, and now we'll come to the clinical part, which is I won't go much detail into the clinical part because we are used to that sort of questions. We have done such questions throughout our medical school and in PLAB as well. So again, these are the three main domains. Learn these very well. Practice, think about scenarios, how just think about, make your own scenarios in head, that how you might be presented with a challenge, and if there's no one, how would you deal with it? And that will help you in the exam. And then let's go towards the clinical questions. So clinical problem solving is an assessment which tests you on your ability to apply your clinical knowledge in and make clinical decisions in everyday practice. The scenarios are based on foundation level, so it's not going to be, you know, very complicated. These are going to be basics, honestly. They're not too difficult. And they are testing your ability to synthesize and apply medical knowledge. It's not just recalling the knowledge. I mean, we all have the knowledge, but it's about how you apply your knowledge to a particular scenario. There are 5 core competencies that would be tested. Investigations. Number 1 is investigations, just to see, they'll see if you are able to, you know, offer relevant investigations uh, to obtain a more conclusive diagnosis or rule out a possibility of injury. So you have to know, if someone comes, you need to do relevant examination, relevant investigation. Um, so that's number 1. And diagnosis, so based on your history and investigation, how you are likely to come to a diagnosis. And yeah, it's just basically making a diagnosis. So you'll have things in your question stem like the history, the examination, and sometimes the lab work, and then you can make a diagnosis of it. And then emergency cases, potential serious illnesses requiring an immediate response, recognizing patient risk based on suggested factors. You've all done this in your lab. You've done your Simmons stations. You all know how would you deal with a case of anaphylaxis, for example. How would you deal with a case of ACS? For example, a patient comes in in GP surgery with a chest pain, you know, very cardiac sounding. You might be asked about the initial things like, you know, giving aspirin, giving GTN, and, you know, calling 999, arranging a blue light call and sending that patient to A&E. So things like that. And then prescribing. So you should be aware of prescribing and reviewing the medications, like the side effects and the common side effects that you should be aware of. And BNF comes very handy here. But when you do the practice questions, you'll do fine. You don't need to specifically go and read the BNF. That's not necessary. Okay. And then management, advising, you know, and, you know, just coming towards a proper management plan. That's what you'll be tested on. So these are 5 core competencies we are all aware of. I don't think there is much to talk about this. And then we will move towards question banks. All right. So so you have the three question banks that I am aware of, which are like mainstream. One is Fast Medicine. It's an MCQ bank, and eMedica. I personally did Fast Medicine when I did this exam 2 years ago. And it's the most detailed question bank. So I would say, if you have time, do Fast Medicine. Because, you know, someone who feels that they do not have very good basics, or someone who feels that they would just want to grasp everything very well clinically, then Past Medicine is the best question resource, because they have a detailed explanation to every question, and they usually give you know, helpful links in the end. For example, if you are reading on Addison's disease, they'll have a YouTube link in the end to read about Addison's disease and, you know, understand that very well. So that comes very handy. So I would recommend Past Medicine as the first one, but it would consume more time. So if you are short on time, then I think it's not the ideal question bank to go for. But if you have ample of time, ideally you should have 3 to 4 months for this exam. The more the better. But if you have 4 months at least, then go for Past Medicine. And then MCQ bank. So MCQ bank is, for example, if you have a month or 2 months, then I would say do MCQ bank. It's the explanations are not very dragged, they are precise, and I think for someone who feels they have a good knowledge base already, I would say go with MCQ bank. Do it couple of times, you'll be fine. E-Medica is a bit expensive, but I don't think it's necessary personally, but you can definitely try. There are a lot of question banks out there. But if you ask me, I would advise you to do past medicine. So, Tina, I can see you have raised your hands. Do you have a question?
Yes, please. I would like to
Yeah.
ask, do you know the total amount of questions, like for past medicine? Do you know their total amount of questions in their question bank?
I don't know exactly, but I think it was around 2,500 to 3,000.
Okay.
Yeah, it would be between 2 to 3,000 in that range.
Okay.
The questions would
Also
be.
for
I
MC.
think MCQ Bank has less. I think it has like 1,600 or 1,800 questions, something like that. But there's a repetition in in past medicine, so that actually helps you prepare better. Someone has commented that almost 3,300 in past medicine now. So yeah, past medicine keeps on adding questions. Um, so yeah, so sorry, where was I? So yeah, those are the question banks. So again, I would say go with past medicine if you can. And but if you feel you have a good question bank and you are someone who is well experienced, you have worked as a doctor for 2 3 years, I would say go with MCQ bank. Do it couple of times, you'll be fine. Now let's talk about the marking and the banding of this exam. So for the clinical problem solving, 1 mark is granted for each correct response. The professional dilemma is actually scored against predetermined keys to make the test standardized and fair for all candidates. Um, there's no negative marking, so you should just answer all the questions. Um, like I mentioned, for most specialties, this score is just going to help you shortlist to begin with, and later on it contributes to some extent for the total score. But for GP, I think they have like a banding system, like 1 to 4. So there is a band 1 to 4. So 2 is minimum band that you need in both parts, both SJT and the clinical part. If you have band 1 in any, you will be disqualified and your application would be withdrawn. So band 2 is minimum. And then again, they'll combine the both and you'll get your results. So again, preparation. So I'll talk a bit about how you should prepare for this exam. Okay, so keep ample of time. Do not do not write this exam in rush, because this is a competitive exam and the scores matter. It's not a pass fail in exam like I've discussed. So you have to score really high, and the competition has gone crazy. Really, what I've seen over the last 2 years, it has gone insanely high. I mean, these days you need 500 plus to get any training. So you leave ample of time for this exam, and the more so the more you do the question bank. So if you do the question bank once, the information is very volatile. You'll forget a lot of things. So the more you revise, the more likely you are going to score better. So I've seen two approaches that doctors do. There are some people who try every question bank. They'll do past medicine, and then they'll do MCQ bank, and they'll do e-medica, and then they'll go and write the exam. There might be some doctors, they might just pick one question bank and they'll just do the same question bank 2 3 4 times. The second group will score way higher than the one who is experimenting with a lot of question banks. So I would recommend you to do one question bank and do it really well and repeat it 2 to 3 times. at least. Yeah, yes, Tina, you have a question. Yes, Tina, you have a question?
No, sorry.
Sorry, okay. So, yeah, ideally, and another thing I would say, start doing, subject-wise. So when you're doing your clinical part, do cardiology first, and then do gastro, do respiratory, neurology, do all medicine questions first, okay? And then revise it again. Then see what are the questions you have done wrong, then revise it again. Do medicine again, then go to surgery, do questions from obs and gynae, and you can, do rheumatology things, and then do peds. So do it subject wise first, and then do it randomly, and test yourself, because time is crucial. Just you all have done your PLAB exams, that uh, time is very crucial in these MCQ exams. So you have to practice with a timer and do your mocks, and practice yourself, thinking that you are in the exam under the time stress. And spaced repetitions, I would highly encourage you to understand this. So spaced repetitions, any exam you'll do, it's not just MSRA. Any exam you'll do, try to do spaced repetitions. I'll explain it further, but I think someone has a question. Hi, Medina. Yeah, you can ask what you have a question.
Yeah, I wanted to ask what's the duration of the exam?
I did mention this in initial slides. I think around 3 hours. I can tell you exactly. So we discuss it in the structure of exam. So 170 minutes you'll have for this exam. Okay.
Okay, I joined late actually.
That's all right. So yeah, so spaced repetitions, why it's important. So I'll explain with something we call Ebbinghaus forgetting curve. So what happens? Your memory declines with time. So for example, if you are here and you have done a topic, at after a week or two, you'll start forgetting it. And if you just block some days in your week and go back and revise that, it will it gets refreshed again, and you would be able to retain that information for longer time. So what I would advise you, if you are making a timetable, every week book the block 2 days where you're not doing any more new questions, where you are not memorizing and learning new stuff, where you just go back and just revise the stuff that you have already learned. Does that make sense? So do not have this approach that you have done medicine, you have done surgery, you do all question bank, and then you go again and revise. No. If you are doing medicine, you have done 3-4 topics in 4 days, you block the 2 days and go back, revise the 4 topics you have done. Next week you have done 4 more topics, you block 2 days, and go through all those 8 topics that you have done. Next week, you have done further 4 topics and you blocked 2 days, and you go and revise all those 12 topics. With time, the chunk of the stuff that you have to revise will increase, and you can increase your you can block 3 days. So to begin with, initially you just block one day and revise back. But when the stuff to revise, when the chunk you have, because of course you have done more questions, you have covered more syllabus, you'll have more topics to revise, and then start blocking 2 days. And you can even block 3 days at times and just revise everything, and just revise briefly, but always go through things that you have learned. So in that way, you'll not forget. And yeah, then you'll do better if you go ahead with this strategy. Okay. So this is called spaced repetition, and I think it's very important. Let me go through chat if someone has. So all right, so there is a link from so if you so there are some there is a link available in the chat. I think if you have to go through these sessions later on, there are resources available that help you to prepare for your portfolio. You can read about it in the chat section. And then, yeah, so that's all about it. Okay. So anybody has any question so far? Anyone? We'll do a sample question and then we'll wrap up the webinar. No? All right. Can you please just show eligibility criteria? Okay, we'll go through the questions in the end. Yes, Farwa, do you have any question?
Hi, my question is actually related to the CREST form, which you explained in the very beginning. So is it okay to ask
Yeah.
right now?
Yeah, sure. What it is about?
So it's probably a dumb question, and maybe you explained it earlier, but like, I just wanted to ask if you're an IMG and you have like not, you do not get it signed from your own country, and now you're in UK. So will that be a problem? Like, can you get it done after working in the NHS, or do you need to bring it along with you?
No, I think the CREST form needs to be in a 3.5 years window before your training, before the start of your training date. So you start your training usually in August in round 1. So that's usually so there are 2 rounds. I'm not sure if we discussed. So there are 2 rounds. So round 1 usually open up in November, and the application window open in November. You give the MSRA usually at around January, February, and you start your training in August. And usually only GP applications go to round 2, but I'm not sure they are going now due to high competition. But the round 2 usually happens around September. So before the start of your training, before the starting date of your training, the CREST form should not be more than 3.5 years old. And you can sign it from someone in your home country. But if you have been working in the NHS for more than 3 months, I think it's recommended you get it signed within the UK, because now you're working in the UK. All
Perfect. Thank you
right.
so
So
much.
no worries. So let's just do some sample questions, and then we'll wrap up and we'll do a Q&A session. Okay. So one example question of the SJT, and then we'll do one sample question of the clinical problem solving. So this question, so Alex is working on an oncology ward. He notices a nurse from a different ward reading a set of patient notes. Yesterday, the nurse had asked Alex for confidential information about her partner's condition, which Alex refused to share. When the nurse sees Alex approaching, she looks guilty and immediately puts the notes back and walk away. Alex does not know which set of notes she was reading, but suspects that she may have been reading her partner's notes. So if someone asks you to, so what would be the most desirable option among these 3? What would be the second number and what would be the last? Anyone? What would be the first option you would pick?
I
I
think
think it
you.
would be C.
Okay.
So C would be the first. Anybody disagrees? CAB.
I'll go with A.
A, the first one, yeah?
Yeah.
Okay, anyone else? what would be the most, or I would say extremely desirable action among all these three? Someone said C, A, B. Someone said A. So the most desirable among all would be A. Okay. So which is ask the nurse in charge for advice about how to respond. So why is that? Because it is Alex's responsibility to preserve the dignity and confidentiality of his patient, as well as to raise concern when he witnesses inappropriate conduct. Okay. However, as he is not certain about what notes his colleague may have been reading, it is important to bring what he has witnessed to the attention of the nurse in charge for advice about how to respond to the situation. So yeah, so the most desirable would be A, and C would be the second one, that you asked the nurse why she was reading a set of patient notes for what she does not work on, and B, tell the patient that he suspects the nurse was reading their note. That would be the least desirable. So that gives you a little bit of idea. You'll get questions you may have to drag and put them in order, however you feel the situation should be dealt with. And another example, let's do one more example. You are on ward round with a senior consultant who frequently makes insensitive comments about patient's weight or socioeconomic background. You feel uncomfortable with these remarks. So possible responses, it's been already mentioned there. A, you challenge the consultant's comments in a soft manner, emphasizing the importance of treating all patients with respect and dignity. So that it might become as like pick one option. So you'd go with that. You are not expected to. Yeah, anybody? Sorry, someone open their mic. Anybody wants to say something?
Depois da information que tá lá, mas a become eligible.
Sorry, Nena. I didn't catch you. Okay.
No, go ahead, don't worry.
Okay, that's fine. And so yeah, that would be the motion you want. You won't confront the consultant aggressively. Of course, you want you don't want to create tension. But again, you should not remain silent and avoid confrontation, because you clearly know that it is not fair for anyone to pass any remarks for a patient like that. So this scenario actually tests your professional integrity and your ability to advocate for your patients. Okay. So the best response would be A. So you'll just get similar questions. And someone I think asked in the chat box that is the past medicine questions bank sufficient? Yeah, I think it's sufficient. It comes with practice. Do not do it just one time. Do questions at least 2 to 3 times. With the current competition going on, I would say at least you should do a question bank 3 times before appearing for the exam. And here's an example of a clinical question you might have. 45 years old woman presents to your clinic with 3 weeks history of persistent cough, productive yellow sputum, also reports tired and slightly short of breath, especially when she climbs stairs. She denies any fever, chest pain, or recent travel, smokes 20 cigarettes a day for the past 25 years, and has no significant past medical history. So in examination, you see temperature 37.2, heart rate is normal, blood pressure is 140/80, respiratory rate is 18, oxygen sats are 95. Chest examination reveals mild wheezing on expiration. So what would be the most likely diagnosis? Pneumonia, COPD, asthma, or heart failure? What would be the correct diagnosis, guys? Anybody wants to answer this? Alistair said B in the chat box.
I'll go with B too.
Any all right. Anybody else? Anybody thinks differently? Yeah, so yeah, that's B, COPD, because the symptoms of persistent cough, productive sputum, tiredness and SOB are all classical signs of COPD. Smoking history is again a significant risk factor, so that supports the diagnosis. Fever is more common with pneumonia. The patient in this scenario has a normal temperature. Asthma typically presents with wheezing that is not constant but can be triggered by specific factors. So you would expect to get some triggers. And shortness of breath with exertion is again a characteristic of COPD. SOB can be shortness of breath may be present in heart failure, but that's typically present, with rest or lying flat. So there would be an element of orthopnea usually with cases of heart failure. So that's straight enough, isn't it? So clinical questions, they are not too complicated, to be honest. It's just that you need to be well versed with the syllabus. Okay. So yeah, that's all about it. Thank you so much. If you've got any questions, we can answer that.
Thank you very much for that wonderful presentation. Really appreciate that. So
You're welcome. Thank you.
if you have any questions, anyone, you can please ask either verbally, like we've been doing, or send it to the chat box. I don't know if you answered this. Faya sent a question earlier. She said, or he or she, I'm not too sure. Sorry, I joined late. If you have time, can you explain how is the numerical score measure? I don't know if you got that. Were you?
Yeah, so the marking we did discuss. So how it's scored is this is the slide. So you get 1 mark for each question in your clinical part. There's no negative marking, so you're encouraged to attempt every question. The SJT part is usually marked against a set key. So for example, if you have done one, you have ordered things. So the first option you have ordered correctly, the second thing you may not be according to the key, then you'll just have your marks deducted accordingly. But clinical part is straightforward. It's just 1 mark for each question.
Awesome. Thank you so
Yeah.
much. Again, please feel
No
free
worries.
to ask any questions just before we round up. We want to thank you for this wonderful professional presentation. Really appreciate that. Whilst we're still waiting for questions, if you haven't subscribed, if anyone hasn't subscribed to our YouTube channel, please do. We've got the link there. One of the advantages is you'll find this video and previous videos, recordings of previous shows. And we started the education series in February 2022, and we have loads and loads of videos there that has captured a number of events we've had, medical legal, how to ace your interview with NHS, etc. Lots and lots of questions and videos for you to go through. So just use the link in the chat box to register, to subscribe rather. And also you can follow us on a lot of social media platforms, Instagram, Twitter, etc. The link is there as well. So please go ahead. Somebody has asked you a question from Amy, I guess that's the name. Please show eligibility criteria. Eligibility criteria. I don't know if you talked about that earlier. If you can have a quick one there. You're on mute, sorry.
Sorry, yeah.
No,
So
sir.
yeah, so for eligibility, if you are a UK graduate here, you have to have your foundation year training. But if you are in IMG, you have to have your GMC registration. You should have done your clubs or membership exam, whatever. You should have your GMC registration before you start your training. And you need at least 2 years of postgraduate experience, including your internship. And that 2 years should be before the training start date, not the date when you apply for the training. You should have 2 years before your training starts, if that makes sense. So yeah, and
Awesome.
you should have your crest form signed, but you'll get a deadline when you apply for it on ODL.
Awesome. Awesome. Someone has raised the hand up. Washma Amir. Can you unmute your mic and ask your questions, please?
Thank you. Am I audible?
Yes, you are.
Yeah.
Firstly, thank you so much for the informative session, Dr. Naman. My question is that this is job market is pretty saturated. So is it a good idea to give the exam without NHS experience? Like, will they prefer an IMG without an NHS experience, or will they prefer someone who has NHS experience?
Yeah, all right. So this is a very common question. I mean, I would personally not recommend anyone to start their NHS journey directly as a trainee because it can be very overwhelming. There's no preferences. As per the selection criteria, they do not care if you have NHS experience or not. If you have the MSRA score, if you have a good portfolio, you have done well in your interview, you'll get the training. I've seen IMGs coming as an internal medicine trainee directly without having prior NHS experience. I have seen some GP trainees as well who have come directly without NHS experience. And again, it's subjective. It depends on you. I have seen some who coped well and they are doing well. But I've also seen people who struggled. Some have even been released from training. Um, I think it depends if you have a good experience. So I had a colleague who came from Dubai directly in GP, and he had done his MRCP as well, and he was already working in a health system which was a little bit advanced. He was a bit tech savvy. He was used to, navigate things and work with the computer, and he did okay. So again, it depends on you. Nobody would recommend it because it can be overwhelming and it can sometimes put you at risk of losing your training seat for some people. But yeah, everyone would advise you to do a non-training job first because number one, you don't have any portfolio stress, you don't have any exams, you get time to adapt to the system. So I think that's important. Try your best to get a non-training job, but if you have to come directly to the training, you would be coming at your own risk.
Okay.
Yeah.
Also, I have another question that for SJTs, is past medicine enough, or is there any other resource that we can go through?
Yeah, I think past medicine is enough. Any question bank, you do just do it repeatedly. There are some foundation year sample questions that you can do. Uh, um, you can just search it on Google. If you go to because people who apply for foundation year, they also have to go through SJT. So there are some sample questions. If you look at the foundation year website, you can try that as well. But SJT, I mean, past medicine and any question bank is good enough. The thing is that you have to be very well versed with the 3 domains which we discussed in detail in today's session. So if you just
Right, thank
do
you so
that well,
much.
you should be fine. Yeah,
I just
no
have
worries.
another question. I'm sorry, and that is there a difference in available training slots in round one and round two, like being an IMG and having not an NHS experience. Is it better to go for round one rather than going for round two?
Yeah, of course, round one. Round one is the main, round two is only for people. Sometimes people leave their training and they're very limited slots and you do not have much options. So I would always encourage to start your training in round one. Another benefit is that you have a bigger cohort of trainees starting together. So support is very important when you start as a trainee. So in round one, you'll have loads of other doctors who would be starting with you. So you'll have a good network around, and you'll feel more supported.
Thank you so much, Dr. Amanda. Thank you so much.
You're welcome.
Awesome. Thank you for that question and also the answer to that question as well. Like I said, we're rounding up soon. If anyone has a question that you want to quickly ask, beautiful. If we don't, that's not a problem at all. We'll be more than happy to share the recorded version of the video on our YouTube channel, like we've always done. Like I said, we started this education series February 2022. We do monthly programs last Sunday of the month, Q&A between 6 and 7, where you call in and ask whatever question you want to ask. To the best of our ability, we'll give you the answer. Can range from anything: job interview, CV, accommodation, anything at all, advice, settling in the UK, etc. We also have quarterly events, like we do special in programs where we invite someone professional like he to speak on certain topics. This month we will not be having a Q&A, just more for a little bit of a summer break holiday kind of a thing. So we'll resume the Q&A next month, August. That's the end of August. Okay, we will send the details, links, and everything. For those who had issues logging in at the beginning, we do apologize for that. We honestly don't know why that happened. The same link that people logged in with was giving problems. Somebody said it reported about a bug. I don't know where the bug came from. Still don't understand it. I tried to log in on my phone. I did log in and I tried again another time. He told me one grammar that I didn't understand. So, we do apologize if you had any issues for that. But if you missed out anything, not a problem at all. We will post the link to the recorded video on our YouTube channel. Like I said, you can go to the chat box and see the link to our YouTube channel and subscribe if you haven't. You can also follow us on a lot of social media platforms, IG, Twitter, etc. In the absence of no other question, rather, we just want to say thank you to the wonderful Dr. Newman Balgari. Thank you for that wonderful presentation. Really appreciate you. And on behalf of Balusega, I say thank you. We really appreciate you. So for the rest of us, thank you for joining in this month. Jenny, thank you for joining in for this special one. If you remember any questions afterwards, and even after you've gone, that's not the problem. Just send a message, an email to balusega@yahoo.com. Very easy. balusega@yahoo.com. Send us an email, and whatever question, just put in the subject, July education series, and just ask your questions. We'll do our best to give you the answer to your question. So till next time, till we meet again, thank you all. We just want to tell the presenter, Dr. Newman, to please wait behind briefly. We'll have a quick chat. The rest of us can leave. We appreciate you. Thank you very much. For those who love football and want England to win, may we win and and make football come home so that there will be bank holiday tomorrow. So thank you very much, and bye for now. Bye for now. Thank you. Thank you. The link, all the links are on the chat box. The email address has been posted. So if you have any questions afterwards, just send an email and we'll be more than happy to answer that. Thank you again. Thank you again. Thank you, Jivan, Thanet. Thank you. Thank you. Thank you. Thank you. Thank you. People are wanting to come in now, but we've closed. For those who have just been admitted, we finished the program. We just finished now. So you could subscribe to our YouTube channel if you haven't. The link is on the chat. The YouTube link is on the chat. Just subscribe. In a few days' time, we'll put in the recorded version of this presentation on the channel, and you also have access to previous videos, recordings of our programs. We've been doing this for over 2 years, and we're happy to say you can follow us for loads and loads of presentations that we've done. So thank you again. So the program has ended now. You can all sign out, please. Thank you very much. Thank you for joining this month. Thank you. Looking forward to seeing you next month for Q&A and the special event in 2 months' time again. Okay, thank you very much. Thank you all. Thank you all. You can stop sharing now, Newman. Yeah. Thank you all. Thank you all. Appreciate that. Thank you. Thank you, Ru. Appreciate that. Thank you so much.